Medic 25, station regularly, on progress, Chevrolet, Reagan, County.
So I'm joined today by Captain Matt Dreher with Arlington Fire EMS, and he's here today to talk about the brand new protocol in his county involving the transfusion of blood products for patients who are suffering from traumatic injury. So, Matt?
Yeah. Hey, happy to be here. Yeah, talking about basically giving fresh never frozen whole blood in the field. It's going to be O positive. We'll talk more about that, I'm sure. But it's not just for trauma; it's also for medical patients as well. Someone who's just suffering from any kind of blood loss where they're compensating for shock.
Very cool. So, what was the impetus for beginning this protocol?
Actually, just some data and research and study. I mean, we get a lot of stuff from the military. They've been using whole blood in the field now for a couple of years. And then in Texas, outside San Antonio, some of the EMS systems out there were using it, and it had very good success with it. Huge success stories. And we kind of heard about it and did some research and liked what we saw.
Very nice. Now, if I'm not mistaken, Arlington County is the only jurisdiction in this area that's using blood in the field?
Well, there's factor R type blood, which some counties are using. We're using whole blood as of right now. But there are some, like Loudoun County, I think either has it or is going to get it very soon. Alexandria is getting it soon. Stafford County, a lot of places in Northern Virginia.
Gotcha. Okay. So, but it sounds like you're very much on the cutting edge, if you will.
Yeah. Yeah. I mean, I'll brag about that. Yeah.
Yeah, absolutely. Absolutely have to. Okay. So who would you use this blood for? What are some of the indications? And then, what would contraindicate somebody for getting this blood?
Sure. So when we would use the blood is basically anyone that's having hemorrhage and shock, right? So it could be someone who has a traumatic loss of blood. So through gunshot wounds, thoracic wounds like to the abdomen, stomach, chest, get baseball bat to the chest or something like that, car injury, and we take that into account, and we also look for a vital sign change. And so the vital change would be systolic right around 90, right, and then a heart rate above that. And so patients who's cool, pale, diaphoretic, perfect sign that the body is compensating for that blood loss somewhere, whether it's external or internal, and then we're allowed to give it. So if someone's having like a lower GI bleed, they're cool, pale, diaphoretic, have lost lots of blood, that's also a candidate. We just had to make sure they meet the parameters. Contraindications as of right now are males have to be above the age of 14 and females above the age of 50. If it is a female that is younger than that, we call our medical director for permission to administer the blood. And based upon a lot of things for that, but we have to be careful with females in childbearing age.
Of course. Now, why, I know you said type O positive blood. Why not type O negative, and how can you get away with giving O positive blood?
Yeah, that's a good question. And we actually, I'm asked that a lot. So the research and data shows that positive negative blood doesn't always mix properly, right? Because we got, there's a little bit of difference. But what we want to do is we want to get low titer O positive blood, because everyone can receive O positive O blood, right? And so if we get a low titer, or that plus sign to be a little less, and that's mostly found in males above the age of 50, if we get that kind of blood, then it has less impact on someone who's negative. And so it doesn't have the same results. And actually studies that we found, it showed that giving someone during a traumatic injury or compensating shock, that they actually don't respond that well to the low titer style blood.
Less chance of a transfusion reaction.
That's exactly right. Yeah, they could still have it, of course, but then you have to look at, well, what's really going to hurt them more? Continue bleeding out the blood. Maybe they can fix that once you get to the hospital. So there's a lot of things to think about.
Gotcha. So why not O-neg? Why? What's the? It seems like an easier choice. Why couldn't you get the O-negative blood?
Absolutely, and I would love to hit the lottery as well. So when you talk about like O-negative, so we're like a mobile blood bank, right? We're allowed to have 2 units of blood, one in each of our supervisor's buggy. But if we go to a blood bank and say, hey, we want some O-negative blood, that's really hard to get. But O positive, more so if we specify low titer, it's a little easier to obtain that and keep in the field. And so that's how we get away with it.
Gotcha. Now you said you only have 2 units. who has access to those units? Like who's carrying them around, and how are they keeping them fresh?
Yeah. So basically it was two EMS supervisors in Arlington, one north side, one south side. And so each of them have 1 unit of blood. We keep it in like a super igloo Yeti style cooler. It's pretty neat. So there's an outside shell. In that is a Yeti cooler, and inside that is one that we keep frozen. We thaw it every other day, and it keeps the blood between 3 degrees Celsius and 6 degrees Celsius. And so it maintains that area because it's like in a triple double layer of protection.
Wow. Okay. Now, if you get the authorization to use the blood, what do you have to have done prior to administering the blood? Like, do you have to give a certain amount of fluid? Do you have to initiate pressor therapy? Like, what is the stepwise type of event that goes on?
Yeah. So pretty much what happens is we want to make sure that we have a good amount of systolic blood pressure, not like a whole lot, but we want to be right around between 80 and 90. So we give a small fluid bolus. But as we know, like with all the study and data that's out there now, is too much fluid is bad, right? Too much acid. Normal saline is very acidic. So we just want to give enough to start circulating, right? And make sure the vital organs are being perfused. That way, when we give the blood, it clots better. It's in the right spot. Also, making sure that it's warmed to body temperature before administrating is super important as well. So what we do is we give a nice little fluid bolus if needed. Then we attach it to a device called a thermal angel. And what that does is we send saline to it first. Once it heats up the saline, then through like a gated Y system or a Siamese system, we spike the blood and it warms up, and we cut off the saline and just start flowing blood. It's really that easy. It takes usually about 2 or less minutes to get it started.
Wow. How long does it take to infuse all of the unit of blood?
Well, we had a transport the other day when we used it, and the transport time was about 7 minutes. We put a pressure bag on there to assist the administration, and we had almost the whole entire unit of blood administered before walking through the EO.
Wow. Okay.
Yeah.
Do you have requirements on like IV gauge and location of the site? And can you put this through something like an IO?
So we can't do blood through an IO. That was new to me actually before we did a little bit more research. But the bigger is better, right? We get a 14, 16, 18 is fine, but the blood can actually be pushed through something as small as a 22 gauge needle. And of course, the closer to the heart, the better. And that's basically it. AC is great, right? You can't get an AC anywhere else you can go.
Perfect. And I think the Zoom was acting a little temperamental there. You said you cannot put it through an IO.
No, you can put it through an IO.
Oh, you can. Wow. Okay.
Yeah.
Very cool. I'm glad I confirmed that. That's really nice.
Yeah, and that's something I didn't know was true, but through research we can push it through an IO.
Very cool. Very cool. Let's see. So if your patient is clearly exsanguinated from some kind of traumatic event, can you give or administer the blood to somebody who's in cardiac arrest?
We do not. So
Okay.
if they're already in cardiac arrest, there's a more so traumatic arrest. We're going to go ahead and just try to do everything we can for that patient the way they are and sustain that unit of blood as needed. But that's something that we definitely call a medical director on and say, hey, we had a pulse, we didn't have a pulse, what's going on? We definitely think it's blood related, and then we push that towards him. And so I think that's really the best course of action for that.
Gotcha. Okay. Now, I know you had this question initially when this protocol came up, but why, with the proximity of so many trauma centers and high-level centers of care in this area, would something like this be necessary?
Yeah, we're very fortunate in Arlington County to be so close to many trauma centers. GW, Fairfax, Arlington County is going to be a trauma center very soon. I mean, everything's a stone's throw away. But if we think about it, it's about door to blood. And so we take the average patient to a trauma center. As soon as we wheel through, we tell our story, right? It gets repeated. They find out APU, they do it again. They make sure everything's going on. They draw blood, right? They send that blood up the vacuum tube to the lab, and then they process and find out what kind of blood. Then they try to match it. If they can't match it or something weird, they get the O negative, which is, of course, super important. And then they take that blood from the blood bank, and then they take it downstairs to the trauma center. So that can take anywhere between like 10 minutes to 30 minutes. Or we can give it almost at point of wound within 2 minutes of arriving, right? So it's they get it right away, and then that can sustain them until they get to the trauma center to get more blood inside of them. If needed even after the 1 unit.
Wow. Okay. Now, have you used this in the field yet?
I have. Yeah, I didn't want to be. I was the first person to use it in Northern Virginia. Nothing that. Yeah, I didn't even want to be the first person, but I was. It was. I used it on a trauma fall, and she was only responsive to painful stimuli, and then within 2 hours, she was talking to the doctors, and she really needed it at the time. So that's a good story.
Wow. So it ended well. It sounds like
it did. It ended very well.
That's great. Now, you mentioned earlier that you would hesitate, or you would have to have medical consultation or medical direction for the use of blood in women of childbearing age. Why is that exactly?
Well, when you give someone blood that's not their titer, right? So you give a positive blood to a negative person, right? They build these little antibodies, and that will affect them more so when they get pregnant, right? Later on in life. And so we have to be mindful of that. Also, when someone's going through a traumatic experience, they need blood, right? And so we have to take account of what's going to be more beneficial. There's drugs out there like Rogaine that can help out with pregnancy later on. But we have to be mindful of not just our patient at that time, but future patients that she's also carrying, right? So with that, in fact, if it's below the age of 50 for females, we call our medical director. We find out, we give him the story, what's going on, and then he can make the decision right then on our administration to that patient. But even if it's a small kid under the age of 14 that's hit by a car, they need blood, right? More so there's internal, we can't get pressure on it, we can't stop the bleeding. They probably need some life-saving blood, so we'll call them up and make sure that we get permission before we administer it.
Okay. Now, what about if you have a patient who is a Jehovah's Witness? How would the blood administration be different here?
Yeah, I completely understand. We got to respect religions for who they are, right? And I think we want to respect those people and what they want. Unfortunately, if they're unconscious and unresponsive, we treat all people as if they would want life-saving interactions that we can provide to anybody at that time. If there's someone there that they can prove that they're a Jehovah's Witness, they have a card on them, some form of identification, and they can prove that is, the relative that's a Jehovah's Witness, then we would not administer it. We would just do everything else that we have. We got TXA. We got all the stuff that we can do to help out besides the blood.
Got it. Okay. It sounds like your tones are dropping.
No, that was dinner call.
Oh, got it. All right. That actually sounds like a really good segue. Matt, is there anything else you want to mention about the blood protocol before we go?
Yeah, I do actually. So there's a really cool program that we're getting. I'm trying to bring up the information right now. Mm-hmm. And what it is it's called Heroes for Blood. And let me just get all the info for that. But what it is it's called the Whole Blood Brigade. And I want to give a shout out to this because it's about you being a hero and giving blood. And anyone can be a hero. And what we want to do is we want to focus on O positive blood, right? And you can go give blood. Anyone really giving blood. But if we receive your blood and you are an O positive donor, then when we get your blood, this program is going to say, hey, we have your blood. We're carrying it in the field. And if we administer it, we'll send you an email and say, hey, your blood saved a life today. And it's kind of a cool thing, right? You won't know who because of HIPAA and stuff like that. But it will be something that says, hey, what you did like a month ago is now saving someone's life.
That's amazing. What a great program to have.
I think it's
such a scarce resource. So, yeah. Wow. All right. Well, Matt, thank you for sitting down and spending some time with me and explaining this really, really amazing new protocol.
Happy to do it.
Oh, thank you for joining us.
All right, man. Take care.
All right. You too. Right. Bye-bye. Bye. To learn more about Arlington Fire and EMS, head over to their website, fire.arlingtonva.us. And if you're able to donate blood, please head over to Innova Blood Donor Services at innovablood.org. Also, check out Arlington's Facebook and Twitter pages for updates on their program involving the use of whole blood in the field. Until next time, please stay safe and continue to wash your hands. Good night.